So, hi everybody. So, I wanted to talk about my breathing issues, and I'm going to talk about what happened this morning. So, at 5:45 a.m., it's now just past midday. So, just over 6 hours ago, 6.25 hours ago, I had a total airway blockage. Now, some people said, "What do you mean by that?" I mean exactly what I've said. That I can't breathe at all. No air is coming in or out. It's not shortness of breath. It's not difficulty breathing. It's no breathing. And it's resolved with a cough or effort, like cough like effort. So it doesn't sound like a cough because it sounds like nothing because I go from to and the length of ability effort that I have to put in to clear my airways enough to be able to breathe is quite significant. And so this was my 18th one, going back about a month. I'd have to look at the actual dates. I think the first one was the 25th of July. It's now the 24th of August. So, yeah, about a month. So, 18 in about 31 days since the first one. Now, this is part of well, I don't know that it's part of because one doctor has now said it might be separate. But it comes on the back of about 10 days before that, I started having this cough, which I'm attributing to having swallowed a chip. And the reason why that's an issue is because, well, I believe, is because of when I was punched in the throat in 2010. Now, I definitely was punched in the throat, by the way. And ever since then, I've had these recurrent throat infections. Now, because we don't have a lot of ENT equipment, at least not near where I live, GPs don't tend to have the ability to see an infection down about there, where I'm pointing about there. That seems to be around about where it is. They can only see up to here. So this is down there, and you can only see that if you get a little tube. And got a bronchoscope, and there's probably some other things you can use. So they don't generally have that in the GP office. And even if I go to hospital, well, at least my local hospital here doesn't have one. So I'd have to go to a specialist, and the specialists have several months of waiting lists. Sometimes 6 months, sometimes a year, by which stage there's nothing to see anymore because it doesn't last that long. Well, it could, but I've tended to take antibiotics to resolve them. So maybe they're not related. Maybe it wasn't caused by me inhaling a chip while I was laughing while watching an episode of The Golden Girls, but certainly 2 hours before the cough started, I was watching an episode of The Golden Girls and I was eating chips and I went, and it just went down my windpipe. It felt like it went down my windpipe, and then I had to cough for about 30 seconds, and it seemed to be fine. But then 2 hours later, more persistent cough started. So that's how it appears to me. Now, I haven't had a lot of X-rays on this area, but my understanding is that when I was punched, it twisted and narrowed my throat, so both the feeding and the windpipe parts of it, and so it's not closed off. I'd be dead, but it's narrowed, which makes it more prone to infection. Now, normally, most of the time when you're breathing, you probably wouldn't care if it's narrow or wide, or how narrow or how wide it is. You probably wouldn't even notice. But when something gets stuck, it creates a partial blockage. It's obviously not completely blocked, or else I'd be dead. If it was completely blocked, I would be dead. So this is a restriction. So it's already restricted from the injury, and so it's further restricted, which creates a bacteria, which then it's my bacteria. So this is not a foreign bacteria. I know you can get bacteria that you've caught off someone. This is my own bacteria that's developing there. This is my understanding of what's going on, at least. So this is healthy bacteria, if you like, but it's because it's, bacteria can develop within your own body. Like, it's my bacteria, but it can develop because it is responding to a threat. And of course, it's a bit inaccurate because I just need to cough it up. But it's sort of, I think it's my body thinking, oh, you need to cough it up to get rid of the chip. So we're going to give you some more bacteria, which is going to irritate you like crazy. You're going to have to cough up the bacteria as well as the chip. And this will help you to cough it all up together. Of course, that's not really very helpful. But this is the kind of thing your body does. It's like how you get certain injuries, you can swell up in a certain area, you get pus, you get all sorts of things. This is your body trying to help you. So you don't need to go to a doctor. But some of the time it doesn't really help. This is a situation where it's not really helping. And in fact, if I don't take antibiotics, this cough never goes away. It's not one that has, oh, it goes away after 3 or 4 days, or one that takes 10 days. And you know, like most coughs, most viruses have a certain amount of time that they take. Because this isn't a virus and it's not contagious. It's not. It is an infection, but it's self-induced, if you like, from my own body. There's no duration for it. It just goes forever. And I could have it, presumably, for 50 years and just still have the cough. The only way to resolve it is with intervention, and the most effective intervention I've had so far has been antibiotics. Usually needs 2 courses in a row and then it goes away. Of course, this thing with total airway blockage is new. I've never had that before, and until a month ago. So the first one of these was, I think it's like 31 days ago, and I've had 18 of them now. Now, it's not a regular thing either. This is not, oh, every day and a half I get one. No. I can have four in a row. I can have a gap of 10 days, you know. Well, the 9-day gap was the longest. So the last one I had a 4-day gap. But what is consistent about it is that all 18 of them have happened when I'm lying down. So I believe it's not possible for me to get this if I'm sitting up or standing up or in any way upright. And I've sort of worked out that I need to, like, I don't need to be 100% lying down, but I need to be, because if I'm lying down like that, that can be enough. But I need to be at least some way towards lying down. And I've tried to work out what's going on because doctors don't seem to want to help me. Well, some have tried to help more than others, but they haven't really. They've been more leaning towards me making the whole thing up as their solution, rather than trying to work out what might be going on. So, got a little bald there from that angle. Not from that angle. Anyway. Anyway, so the thing is that, so last night, so I'll explain why I was still up at 5:45. So that was a weekend. I probably was starting to feel sleepy at about 1 a.m. My wife's not staying here at the moment. She's having a weekend of staying at someone else's place, house sitting. And, you know, I haven't worked for a while because of my broken foot, so not for almost a year. My foot still hasn't healed, not completely. And anyway, so, yeah, I was probably going to go to sleep about 1 a.m, but I was actually playing around with Grok, which is Twitter or X. I hate saying X. It's their AI. And now Grok is hopeless. I'll just have to say that. I've tried everything. Anything that I have any even basic knowledge of, Grok gets it wrong 100% of the time. They never add to my knowledge of something that I have even a little bit of knowledge of. I'm not talking about areas where I have an insane amount of knowledge and like nobody could possibly know more. I'm talking about areas that I just know a little bit more than the average person. Grok will get it wrong with everything, and it's really annoying. So the only times when I find Grok even a little bit useful is about things which I know nothing about or very little about. And it can add a bit to that, but then it gets things wrong. Like I was trying to say, oh look, I said, tell me how many days I did work from home, and I gave it all the information. It said, oh, this is 74 days, or this is 90, this is 87. So it can't add up? What? How can I trust Grok when it can't add up? So I ended up doing it myself. And can't can't do basic maths. Just worrying. It's worrying for me that a computer can't do basic maths. And, and it corrects itself and gives itself four different answers. Nonetheless, I was asking about something I didn't really know very much about, and it was vaguely interesting. And the problem is that Grok can take 20 minutes to respond, and then it is very inaccurate. It'll make lots of mistakes, so then I have to spend time correcting it. And often just for one question, I'll have to correct it 7 or 8 times because it gets things wrong. And each time is 20 minutes, so just one question is taking an hour and a half for one question. It says it's quick. I wonder if that's like a deliberate thing to sort of try to make you spend longer with it and therefore wanting to pay for it and all sorts of stuff. So I have had times when I paid the money to upgrade my Twitter or X account to premium, just like $30 a month or something, and just to so I could get unfiltered access to, or complete access to the Grok without restriction. And it was useful for some things, and I don't know. But anyway, so that's what I was doing. That's why I was still up past 1 a.m. Went to bed about 3:30 because I was just so exhausted. That was enough. Well, was it 3 a.m.? I think it was more like 3 a.m. And then my cat decided to sit on my legs, and I was like, "Stop it! I want to get under the covers." So over the covers, and it just decided to sit on my legs, and it was nice. And I didn't want to move. I didn't want to upset her, but I had to move under the covers. So eventually kicked her off and moved under the covers about 4:30. So I tried to sleep, but I had a lot of water. Well, I don't know if it was water. I don't know what it was, but there was liquid that made it. It felt like my whole body was swimming in liquid, and I was like, "Why is that?" I felt like I was gargling, and that's a very strange thing. Like, I was like, did I just drink a whole heap of stuff and I can't remember doing it? No, it was a bit strange. And so I was having to cough up a lot of stuff to not have that sensation of wateriness. And I hadn't had it while I was sitting up, so I only had it when I lay down a bit, And I was like, that's weird, isn't it? It's weird that this is happening, and I couldn't sleep until I'd sort of done that, and then I got rid of it all. About 5:30 I tried to sleep, and obviously it takes a little while to get to sleep, and I was extremely tired. I was like 4.5 hours beyond when I felt like going to sleep. So partially thanks to Grok, partially thanks to my cat, and just lay down, and after about 15 minutes I had the total airway blockage. A lot of people have said, "What do you mean by total airway blockage?" Why are you asking that? I've said 3 words that are pretty self-explanatory, aren't they? A total airway blockage is a total airway blockage. It's my airway does not let any breath in or out. That's it. That's it. It's just completely blocked off. So this is the 18th time this has happened. So by this stage, I'm perhaps not an expert on it, but I know a bit more than I did on my first one. And I'll try to demonstrate with this. So obviously I try to resolve the blockage, and I know at this stage that a cough, or it doesn't actually sound like a cough, but it is a cough, but a forced cough will resolve it. So a maximum amount of pressure. Now, I previously said I need to have this amount or less. Now I'm going to demonstrate. So apologies for people who don't want to hear someone coughing. It is this much. Anything less than that would not resolve it. So that's as hard as I can cough, hard as I can force things out. And I think I've explained before, it at least feels like the cough's down there. Now, they've looked and there is nothing up to there. So it is somewhere in that little region. I don't know exactly where it is. It feels like it's there. I reckon there's a very good chance it's there. But that's as far down as the doctors can see when they look down. So they can look down about there, So it's somewhere between there and there, what they call a lower respiratory tract infection. Obviously, I'm coughing for some reason, and since it's not in the upper respiratory tract, it has to be in the lower. They've done chest x-rays, it's not in the chest. It's not in the lungs. So it has to be in the lower respiratory tract. They haven't actually done checks on that, which I find interesting. I've been to the hospital three times. They don't see the value in doing a neck x-ray. Could have done a chest and neck x-ray at the same time. They decided to just do the chest one, which showed nothing, as I kind of expect, because it's not in my chest. But no, it's not in my chest, because it would feel different if it was in my chest. It's in my lower respiratory tract. But anyway, so it blocks off there. And I just explain it like, I do it like that, so if I do it this way. But that's how it feels like. So normally, if you like, your airways are like that, or for me, they're more like that, at least in that spot, because it's twisted and narrowed. With the throat infection, they're more like that. So still a bit of a break, but when it completely blocks off, it's like that. It's completely sealed, and I obviously can't see it. They haven't bothered to do any checks on it, but this is how it feels, and it's completely blocked off. So I can't speak. I can't breathe. I can't breathe in or out. No, I'm out of breathing. So if I go, that won't happen. It won't block. It won't break the blockage if I just go. So it's not like it's a temporary little film. This is quite a solid thing, whatever it is. Now, when I cough that hard, it goes from completely blocked like that to like there. But maybe it goes a bit more like that. I don't actually know. But because I've coughed that hard, I get a headache, like straight away. Like it hurts my head. It hurt my head doing that just now, and so it's like a physical headache, self-inflicted if you like, and it lasts, I don't know, half an hour, 40 minutes. So I'm quite disorientated for about 30 minutes, 40 minutes, and of course coughing like crazy after that, every time, and can't breathe properly for at least that length of time. And then afterwards I'm just so rattled, I'd often start crying and be really upset, and it can take 5 or 6 hours before I'm in any way back to myself, and that's assuming that I was in a good shape before. And so this has only ever happened when I'm lying down. So I've got to be lying down like that. If I'm like that, it's never happened like that. So after 18, you'd think if it was going to happen sitting up or standing up, it would have happened by now. The odds of that being a coincidence are pretty low. However, I don't have to be lying flat. This is the interesting thing. So a few times I thought, I'll just lie like this. And so it's like that. And that's enough. That's not. But that is. So it doesn't have to be completely flat. I can be like that, and it can still happen. And I'm not sure where the spot is where, like, is it can't happen there, but it can happen there? Oh, sorry, I'm doing that wrong. So can it happen there? Like, it can't happen there, and it can happen there. Is it like 30 degrees? Is it 40 degrees? What's the degree? But it certainly has to be less than 45-degree angle in order for it to happen. Now, I'm not deliberately trying to test it because I don't want this to happen, because it's a horrible thing to happen. But over the course of 18 of them, there are some patterns that I've noticed. I've also noticed that I get a bit of an early warning for it. And I got this the last time I had one on Wednesday, so 4 days ago. And I got an early warning. I was like, oh, I better sit up. And then I thought I was okay. Lay down, and still happened. And I was like, oh. So this time I actually felt a lot of fluid. And it felt, and obviously wasn't actually, but it felt like, I can actually give an amount. It felt like there was like 2 or 3 litres of water in my mouth, down my throat. Now obviously there wasn't. I don't know where I got that number from. It just felt that much, which would be half my head, If you can imagine this size head, I could probably fit maybe 4 litres of water. If you just went and made me sort of force it in there, assuming my head's completely hollow, it could probably fit about 4 litres. That's a gallon for Americans. So that's about how much my head could fit in. So if you basically scraped out all the insides of me, sealed off the end there, you can fit probably 4 litres. So 2 or 3 litres is pretty implausible. I'd be having water drop out of my eyes and my ears if that was the case, and my nose. I wouldn't. It just wouldn't happen. It's quite ridiculous, and I certainly wouldn't be able to breathe. But that's sort of what it felt like. So I went and I started coughing things up as much as I could into my spittoon. Now, I don't know if I should show that to people, but I have a sort of a drink container where I've been spitting into, and I'll wash it every so often and all that. Then I changed it over because it's just an ordinary drink container. It's one that had orange juice in it, and it's got a handle. It's actually a 3 litre thing. I just find that one most convenient. I've tried different sizes, different shapes, but that one's nice. And it's more hygienic to do it that way rather than just spitting into sinks and onto grass and all that. So I had that, and I tried to spit as much as I could into that. Tried to lie down and sleep. So I'd probably only really tried to sleep at about 5:30 because I'd had all this liquid, and 5:45. I don't think I could honestly say I was asleep, and so it didn't wake me up, but I just sort of felt this blockage. And this time was a little bit different because this time I was just so exhausted that I couldn't do that big cough. So instead of doing that big cough that I'd done every other time, I just sort of went much lower cough. So just as a reminder, this is the big one that I had to do every other time. Oh God, what did I say that? That hurt my neck. But this one was more like... It's a fairly forceful cough, but probably like a quarter the power of the big one. And I did this, didn't actually resolve it, so I was just so tired. I was like, oh, fine, I'll go. And it was fine. Now, normally, and I think it's better to explain this by using my fingers. So normally to go from, this is the total airway blockage. So let's say that about that is my normal with my cough, because it's infected there. So this is my normal without the cough, and this is probably most people's normal because they don't have the narrowing. So it's not actually that big, it's a bit smaller, but I'm just trying to demonstrate proportional. So this is your normal amount. It's not actually that big, but again, I'm just trying to demonstrate with proportions. My twisting and narrowing, it's more like that normally. And with the infection there, the chip caught in it, it's more like that. So when it goes to a total airway blockage, it goes to that. And when I do my big cough, it'll go back out to about there. So actually be a bit better than my normal infection level. But this time, I didn't cough as much. It went from there to there. So it's only barely able to breathe. And that's what happened this morning. So I was only barely able to breathe afterwards. I was just so tired I didn't care. Now, notably, this is not a shortness of breath episode. Shortness of breath things are not dangerous. They can be a bit nerve-wracking, but there's people that live with shortness of breath for years and years and years, and it's just mildly annoying. I have had shortness of breath with this, not with the total airway blockage, but with the infection. In fact, I've had shortness of breath since I was punched in the throat. It comes every so often. It doesn't normally last very long, and I'm not going to demonstrate because it'll make me sick. But, yeah, and that just brings along a cough. So anyone familiar with shortness of breath, I have had shortness of breath for this, but this is not my complaint. So the shortness of breath doesn't bother me. It's just mildly annoying. Even the cough doesn't bother me. It's just mildly annoying. But the total airway blockage is obviously not simply mildly annoying. This is serious. This is something that could kill me. But this morning I was just so tired that I just couldn't get the energy up to cough that hard. And I knew I should have, but I just couldn't be bothered. And so it took a bit longer than normal. So I've been coughing it up in 5 seconds, 2 seconds. So this took about 30, 40 seconds. Now, 30, 40 seconds without breathing is not a big deal. But then I probably would have tried harder later had it not worked. But it actually worked at that level. And it's very strange, because I thought I had to cough harder than that for it to work. So I kind of proved, at least this time, I didn't have to cough as hard as I thought I had to. And a smaller amount of effort could work it out. And after I coughed it up, and people have asked me, what did you cough up? I've never seen what I've coughed up. So I've never seen something come out and land somewhere. So I don't know what it is. They might say, oh, surely it's phlegm. It's what the doctors at the hospital said. They've said, oh, surely it's phlegm. Well, it might be. But I've never seen it. And I also don't know if it's coughing all the way out of my mouth, or if it's just coughing from there to, let's say, there, so somewhere else within my throat, or it's coughing there into my mouth. I don't know if it's getting all the way out, and I don't know if it's phlegm. I can't think of what else it could be, but maybe it's some of the bacteria. Maybe it's a bit of the chip. I don't know, because I've never seen it. And I mean, it doesn't. I don't know what it feels like. It sort of does feel like it's probably phlegm. So I'm willing to go along with their theory that it's phlegm, but we haven't proved it. We haven't proved what it is. And I know the blockage, the partial blockage, is not just phlegm. That's bacteria. There's a chip there. Some structural damage that's narrowing the throat. I know that there's structural damage. There's a bit of a chip, and there's bacteria there. And is there phlegm as well? Maybe. But which is the bit I'm coughing up? I actually don't know. So I'm not going to say it's definitely phlegm. That's a candidate. It's possible. But I don't know. And the doctors don't know. They haven't seen it. They haven't visualised it even, because they haven't done a neck x-ray. They haven't put the tube down to look at it. Of course, if they did put the tube down, they wouldn't be able to see it with a blockage, because if I've got a blockage, I'm dying. And I'm coughing it up, and I don't want to have a tube down my throat while they're doing that. If they had a tube down my throat, I'd go, so, because there's no way I'm just dying so they can investigate it. No way, I'm not going to let them do that. And, but yeah, so it actually wasn't as scary this time as it was the other 17 times. Probably because I didn't put as much effort in. And I was so exhausted that, when you're very, very, very tired, we don't always care as much as you do when you're wide awake. And I suppose I wasn't asleep, so I wasn't yet asleep. And I actually just, I tried to just continue sleeping. I couldn't, because there was so much liquid there, and I don't know why. It felt actually more than it was before the attack. If I said it felt like 2 or 3 litres before the blockage, it actually felt like it was more afterwards, more like 4 or 5 litres. And obviously, that wouldn't fit 4 or 5 litres in my head. It would, even if I was dead and you just had my skull, you wouldn't fit 4 or 5 litres. Even if you, blocked off all the orifices, you're still not going to fit 4 or 5 litres. So, obviously wasn't 4 or 5 litres, but it felt that many. And I didn't cough up 4 or 5 litres. I mean, I've got my spittoon there. If I was going to guess, that's somewhere around 100 mil. So 1/10 of a litre that I spat up last night or this morning. So not 4 litres, not 5 litres. Still a little bit of liquid there, but most of it's been coughed up. And that probably took about 3 hours to cough all that up. And so obviously I couldn't sleep while I was coughing it up. I tried, but I couldn't. So I probably drifted off to sleep around maybe 8:30, 8:40. And then I had about 2 hours sleep, maybe 2.5. And then I woke up. I probably had more like 2 hours. I think I woke up just before 11. So you might think, well, 2 hours of sleep, that's not your night's sleep. Your night's sleep is 8 hours, even if you sleep less at 6. I'm someone that always slept 8 hours. Sometimes sleep more than 8 hours. But I need my 8 hours, and 2 hours is not enough for me. But during this whole ordeal, the last month, I've had a lot of nights where it's been 1 hour, 2 hours, half an hour, and I've been going 2 or 3 days without sleeping even a minute. So I'm probably talking about in that month averaging about an hour and a half. Now, when you've had an hour and a half sleep or 2 hours of sleep, it's sort of strange that usually if I had that little sleep, I'd feel exhausted all day until I caught up the sleep. But for some reason with this, I'd feel a lot more rested than I should. So I actually feel quite well rested now from 2 hours of sleep. And I'd say, how can you possibly feel well rested after 2 hours of sleep? I mean, I couldn't sleep because I had the fluid wherever it was. Felt like it was in my mouth. It didn't feel like it was on my lungs. It felt like it was up here. It felt like it was around there. So not in my chest, not on my lungs, up there. It's just weird. So maybe it was actually on my lungs, but it didn't feel like it was in my lungs. So this is weird. So still feels a little bit like it now, but not as much as it was. So it's kind of a bit of a weird thing. Like on one hand, I actually thought, oh, what if I go to the ENT appointment, which I'm having in 2 days? What if I go to that and I haven't had a total airway blockage for a week? It would have been 6 days. I thought it was Monday that I had my last one. It was actually Wednesday I checked. And I thought, oh, what if they'll just say, oh, you don't have it anymore? So I was kind of relieved in some ways that I had this, because then I can say, oh, well, I've still got it. But I am a bit nervous because I sort of feel like, what if they go there and they say, oh, didn't find anything, and they reassure you? And I hate that. I really hate that when you've got something clearly wrong with you and they reassure you that there's nothing wrong. That doesn't reassure you. Them finding some massive problem reassures me. Now, obviously, if they find a massive problem, then that can make you worried. But I'd rather them find something than them say there's nothing wrong with me when I know there is something wrong with me. So I'd rather them find something and then they know how to deal with it. Because if they don't find anything, then I'm saying, well, okay, you're looking wrong. Try a bit harder. And if they just give up, I mean, it's clearly not in my head. It's not a situation where I've just invented it. I am clearly coughing. And we know. I've tested for viruses. It's not a virus, at least not that's 8 normal ones. They've checked in the chest. It's not there. I checked by looking in my mouth. It's not there. So they know it's in that little section. I've got no doubt about it. Unless they think I'm just forcing myself to cough the whole time. Which is a bit of a ridiculous claim. I'm clearly not, and you can demonstrate that I'm not. Then they know that I've got a lower respiratory tract infection. So, because that's that little area. That's the lower respiratory tract. They know it's in there. That's where it is. Now, I suppose we can't guarantee that it was caused by the chip. And we can't guarantee that it's my own bacteria causing it. It could still have been a bacterial infection that I caught. So I've had it for, I think it's around 45 days that I've had the lower respiratory tract infection, I'm going to call it. So I've had that for 45 days. So that's a bit too long to be just a little virus. And, the idea that this is my own bacteria causing it, to me, makes a bit of sense. But as for what's causing the total airway blockages, it's a mystery for me. So there's been a lot of bad doctors that didn't know what they were doing, but I've had 2 that gave me good insights and good guesses. So one of them said that that's actually a part of a normal, bacterial infection that's caused by having a chip stuck in your throat. So he said, oh yes, you would normally get total airway blockages when you lie down, positional, because the chip or whatever's causing the partial blockage, causing the, you have trouble breathing, it's going to change when you lie down. So when you go from there to there, let's say there's a little chip stuck in there, it's going to change with how you change. I said, how come I didn't get it previously? Because I've had I've had chips stuck in my throat maybe 12 times in the last 15 years since I was punched in the throat. So since that happened, and I just want to note this. Can you even tell that I've got an Adam's apple? This used to stick out. So until I was punched, stuck out. It was quite prominent. And you might say, "Oh, you got a double chin now." Yeah, fair enough. But where even it's there. That's where my Adam's apple is. It used to be quite a lot more significant. So, so that changed. Now I don't know what that means, but it changed. So it's still there. I still have an Adam's apple, but it's not as prominent as it is. It's almost as if somebody got a little grater and shaved a bit of it off. There's vocal cord damage, all sorts of things like that. I have permanent difficulty swallowing compared to before. That's sort of just a normal thing. In fact, they've said they need to do open neck dissection to cut into there and then just sort of move it around and fix it. So they haven't done that because they say that's not life-threatening. It's not on the outpatient list. So I'd have to do that either as an emergency if it becomes life-threatening, and say arguably these total airway blockages are life-threatening. Maybe I can get them to do it, or I go private. And if I go private, you have to pay a lot, money I don't have, all that sort of stuff. So this is so that's interesting anyway. So I can't remember what I was up to, but yeah, so it is good in some ways that I had that, and then I can say something to the ENT that I'm seeing on Tuesday, but I'm nervous that they'll put their little camera down there and go, "Nah, it's fine." Do a little neck X-ray and say, "Nah, it's fine," and then say, "We can reassure you that there's nothing wrong." I think that would upset me a lot if they said that. Now, obviously, I've heard them say it could be cancer. It could be a kind of throat cancer or something like that. So obviously, if they say to me, "Oh, it's inoperable throat cancer, you've got 3 weeks to live," that's probably not the best thing to hear either. But at least I know. So given the choice, I'd rather be told, "Oh, you've got inoperable throat cancer." Not that I think it's throat cancer, but I'd rather them say you've got inoperable throat cancer compared to them saying, "Oh, I reassure you there's nothing wrong." Of course, I'd rather them say, "Oh, it's a cyst, it's a lump, it's whatever it is." Let's say it is cancer. But they say, "Oh, we can just do a simple surgery and remove it." Good. Or if they say, "Oh, this is just secondary to the chip stuck in your throat," we can just send a little whatever in and just pull it out. I'd rather that it's not serious, or it's not inoperable at least, and it's a fairly simple solution, whatever that solution is. So the worst case for me is for them to tell me incorrectly that there's nothing wrong. So that's worse than them telling me that it's an inoperable throat cancer, for example. I'm not saying it is an inoperable throat cancer. I've seen nothing to suggest it's a cancer, but I have heard them mention that it could be a cancer. They didn't say it to me, they sort of whispered it to each other. I mean, if that's the case, seriously, they've stuffed around for like 6 weeks. Get to the bottom of this. Maybe if it is that and they say it's inoperable, well, maybe it was operable 6 weeks ago. Stupid idiots. But obviously there's a lot of cancers that can be removed. So if it's a lump, and then they can perhaps get some scissors down there and cut it off, hopefully that fixes it, whatever the case. Now, thing is, so I think I said yes. So I said 2 doctors had ideas. So one of them said, "Oh, this could be secondary to the chip stuck down your throat. It's the bacterial infection caused by that, and that it's normal because just your blockage twists around as you lie down, and there's a chance of blocking. And the reason why it didn't happen previously is probably because I was more calm, and he'd suggested that this was a relation to me having extra stresses on me because of a lot of allergies, because next door they're building a house and they're being quite irresponsible with it, and they just throw dust up and all that. So that's one option. And the other option that a doctor suggested, I mean, there's a lot of stupid things they've said, but another one that one suggested is that it's actually separate. Because he pointed out that the throat infection started like 45 days ago, and I first had the blockage like 32 days ago. I'll have to check the exact dates, but like 10, 13 days afterwards. And it could be completely separate. So in other words, that whatever's causing the total airway blockages is not related to whatever's causing the coughing. So I have two different things going on. Now I already know that I have another thing going on, which is coughing due to the allergies. And some of the stupid doctors that have suggested it's just allergies. I'm going to go over just for a bit of a laugh. I find it stupid. It's a stupid thing. What the different people have said, different doctors. So when I first went to hospital, the consultant I saw there, and I'm not going to say what I can't remember her name completely, but I'm not going to say what I think it was. She told me that it was a common cold. And by the time I went down there, I'd had it for about 15 days. Common colds don't last that long. So I'm going to say that I had already had a test to see what viruses I might have, and they'd tested for the 8 most common respiratory viruses, which include a common cold, COVID-19, influenza A and influenza B. I'm not sure what the other 4 were because it wasn't on my little list, but came up negative for all of them before I went to hospital. The hospital then did another test for the same things because they didn't trust my GP's test, and it came up negative for all of them. So she was completely wrong for it being a common cold. It wasn't. I'll also point out I've never had a common cold, and I've actually been tested for immunity to coronaviruses. I was tested in 2009, and I was found to be immune. So naturally immune. I actually have never had, sorry, I shouldn't say never had. I stopped taking the flu vaccine when I was about 18. It's not that I'm anti-vax or anything. I stopped taking it because they changed the ingredients in it, and something that was in it, can't remember what, I was allergic to. So they said, well, we can't risk you taking it, because there was a risk that by taking the vaccine I would have an allergic reaction and potentially die. So they ordered me not to take it. And it's been 33 years, I think. Since then, I've never had the flu. So, I mean, there are people that are not vaccinated against the flu and don't get it. But eventually you will. You might go 3 or 4 years, but then you'll catch it. So they did a test for that because of the unlikelihood for me to have never had the flu when I'm not taking the flu vax. And they won't let me take the flu vax, by the way. I've said, no, I'm happy to take it. They won't let me. And I probably shouldn't have taken the COVID-19 vaccine. Not that it's a bad thing. And I took 2 different types of vaccines, by the way, so there's more than one vaccine. Just because our government changed our mind as to what they thought was the best one. And I actually had reactions to the vaccine, quite scary negative reactions. But my employer required me to take it, no excuses. So I couldn't say, oh, I'm immune to coronavirus, this is dangerous for me, and this will potentially remove a coronavirus natural immunity. So I haven't been tested for immunity to COVID-19, only to coronaviruses. And when I was tested in 2009, COVID-19 didn't exist. They might say, oh, you might not still be immune. I might, well, in theory, it's possible. The only way that the immunity could have left, sensibly, is if the COVID-19 vaccines, I've taken 3, if they removed my natural immunity to coronavirus, or if I was never naturally immune to COVID-19 in the first place, because that didn't exist when I was tested. I've never been tested for immunity for that. And maybe you know, something's happened there. You know, but yeah, chances are that I'm still naturally immune. I've never had COVID-19, but yeah, so I think we looked it up. It's like 98.53% chance that I'm naturally immune to still to all coronaviruses, including COVID-19. I don't know how we got to that figure. I feel like I just plucked it out of thin air. And it's probably not the right number, but it'd be pretty close to 100% chance that I'm immune to all coronavirus. So given that, them suggesting that I had a cold is extremely irresponsible. The duration was too long. I'd already tested negative for it. I'm naturally immune to the cold. My symptoms didn't match it. So, yeah, really irresponsible diagnosis, just not a safe diagnosis, like you say. Like, it's just, there's no way it could have been. But that was what they said. That was what they officially said. You know, a consultant, which is, so for people that are not aware of the hierarchy of doctors, so you basically have an intern is the lowest, then a resident, then a registrar, and then a consultant. Now, there may well be more than that, and of course, above consultant, you get to specialists and all that. But essentially, particularly in the emergency department, when they tend to have mostly lower level doctors treating you, inexperienced people that don't know what they're doing, having a consultant, they're probably going to be one of the top people in the emergency department. And I actually know how they do it. Nobody wants to work in the emergency department, so people are forced in there. And that even happens for consultants. So it's kind of why you get different people all the time. So let's say that the hospital has 100 doctors. Out of those 100, you're probably going to find that they need, let's say, 7 of those 100 consultants. I'm saying 100 consultants, sorry. 7 of those 100 will need to be in the emergency department. But in your typical hospital, and I've worked in hospitals, only maybe 2 or 3, probably maybe one or two, maybe none will actually want to be in the emergency department. So they have forced rotations. So let's say a consultant wants to work in, I don't know, let's say orthopedics. That might be the area that they like. They'll be forced 1 day a month to work in the emergency department. So, and they can work in orthopedics the rest of the time. So that doctor that saw me almost certainly didn't want to be there. The junior doctors don't mind because they know that's what they have to do if they want to get higher. But once they get to consultant level, they really don't want to do it. They're like, do not want to go in the emergency department. And specialists say outright, no. And you can't force me. And yet generally they don't work in the emergency department. So, particularly at night, particularly outside of normal hours. So this doctor told me it was a cold. Yes, she was a consultant. She almost certainly didn't want to be there. Granted, she was only in there at 8 a.m. or 10:30 a.m. when she saw me. She's probably just working a normal, 8:30 till 5 a.m. or 8:30 a.m. to 5 p.m. shift, day shift, and just really didn't want to be bothered with me. But she said, it's cold. Said, forget about all this fancy stuff. It's a cold. You're going home. Have a bit of rest. It'll be gone in a couple of days. And the reason why she said it could be a cold is because she said, hang on. The patient says it's been 15 days. Doesn't mean it has been. We haven't seen it before. Could have only just got it a couple of days ago. Could be lying about it being 15 days. And essentially just tried to make it fit and give themselves the least amount of effort possible. So just said, it's a cold. And they actually did a respiratory test themselves, and they did it at about, I'm not even sure when they did it, maybe 3 a.m. Came back at about 3 p.m. So the people doing the tests, what's the name of the people? I can't remember the name of the people that do the test. They'd taken however long, and then they came back at 3 p.m. and said negative for everything. Now, I'd already had negative for everything a week before. Already had the diagnosed immunity to the colds that they know about, but they reject. And so they discharged me at 10:30 a.m. and at 3 p.m. 4.5 hours later, said, oh, negative to, amongst other things, the cold. Negative to all of the things they tested me for. It's not like they're, oh, negative to the cold, but positive to whatever else they tested me for. Nope, negative to all of them. So, that was wrong. Comically wrong. But they kicked me out. Didn't call me back and say, oh, whoops, we're wrong. Got a little message on my phone saying, you've tested negative to all these tests. I knew I would, because a week before that I'd also tested negative to the same things. The same group of people tested me for both. I don't know if they were different centres. I don't think they were, but the hospital should be respecting the other ones. It's not. They use the same people. The radiology, is that the word? Anyway, they they use the same people. The hospitals and GPs. It's not like, oh, you got a GP group that tests it. We can't trust them. Hospital one is more serious. No, same people. Same people that work in hospitals and work in GPs that do the same tests. I don't know, it was a week later, so maybe in that intervening week when I didn't have it a week before, caught it, and now I had it, particularly if it's a cold. Colds only usually last a few days. They'll probably last like 4 or 5 days. I'm not sure, I've never had one, so, but that's what I've heard, could go out to 8 or 9 days, but, me having it already for 15 days should have really eliminated the possibility of it being a cold, and in fact, even your really nasty flus usually don't last that long, so should have already been able to throw that out because of how long I'd had it. So then the second one, I went in and this guy was just an idiot. So he said, we recognise that it's come back negative for virology, but it's a rare virus. A rare virus. Okay, which one? Don't know, don't care. Go see your GP. If it was a rare virus, it's a serious issue. I mean, I can laugh about it, but if it was one of these rare ones, like let's say the Epstein-Barr virus, the Ross River virus, all these ones that you can have for like months, these things are life-threatening emergencies. So and if I did possibly have one, he should at least have a guess as to which one. It's there's hundreds of them. We don't need to look. Look, I know you don't want to be in the emergency department because you'd rather be whichever field you're normally in. But you're supposed to at least guess, even if you don't do a check. At least let my GP do a test. So send a little discharge summary saying, could be a rare virus, potentially consider Epstein-Barr virus, Ross River virus, whatever other ones they feel like saying. There was nothing to suggest that. And he also said, it could be just the allergies. So I've never in my life been coughing things up from allergies. That's never happened. Well, maybe this is a new allergy, a new allergic reaction. Some people do cough things up with allergies. I don't, but some people do. Maybe I'm confused. This is just an allergy. And then when I put in the complaint in, they said, it's just a bronchospasm. Just a bronchospasm. And I had to look it up. Bronchospasm is a life-threatening emergency. It's when you get a total airway blockage caused by allergies. Now, the main difference between that and what I've been experiencing is that what I've been experiencing doesn't last a specific period of time. So bronchospasm would last, let's say 10 seconds, let's say 20 seconds, let's say 30 seconds. And you wouldn't be able to resolve it, and it would just fix itself by itself. So it'd be basically a spasm where you go from there to, that sort of thing. Whereas mine is just going, and just staying there. And also bronchospasms are not positional. So I had to look this up, and maybe I'm wrong, but I should have had at least a few of them sitting up. Shouldn't have had to be lying down for all of them. And it also should be while I'm exposed to allergens. So if it's dust causing it, then it should be dust in the area. And yet it happened in the hospital as well. No dust in there. Certainly not a construction site next door. Why did it happen there? So, the chance of it being a bronchospasm, while technically possible, very unlikely. Just, a million to one sort of thing. And also, it's not just a bronchospasm. It's quite a serious, life-threatening emergency. And if that was the case, they should be dealing with it. Now, the third one, when I went to the third one, they actually said, all right, well, it might be that. And then they said, we don't have ENT equipment. Now, I know not all hospitals have all the equipment they need, but they can transfer people. Can transfer people to other hospitals that have the equipment that they need that they don't have. She decided not to do the transfer. Said, oh, it probably is a life-threatening emergency, but we're not going to deal with it. Wrote me a referral to an ENT that she said it could be several years. She said it could be years. So I was sort of thinking in my head, it's 2 or 3 years. But then she wrote a discharge summary to send to my GP to write a referral. And then the first GP didn't write a very... He put it down as thinks that he has occasional shortness of breath. What? Thinks, so it's not believing me. Occasional. It's not, well, I suppose it is occasional. Shortness of breath. Well, I do get occasional shortness of breath. But that's not the main issue. And I saw a different GP, and I shouldn't be seeing 2 GPs about the same thing. Gave it the same discharge summary, and I mean, I know some people say, well, you're not supposed to do that, you've got to stick with one. And this one actually wrote it as an urgent thing, and he said, he thought it might be separate. He thought that the blockages might be separate from the coughing, so that I could have the infection, maybe caused by the chip. Who knows? I mean, maybe. I think the chances are that it was caused by the chip, but obviously I can't prove that without having a tube go down my throat to check. So I'm guessing that that's what caused it, because that's what caused it every other time. Although, to be fair, I don't know that it was every other time, because ENT just have such ridiculously long waiting lists that you can't prove these things. They're just left guessing. I know it's lower respiratory tract. Can't think what else could be. That doesn't mean it's definitely that. So it's definitely lower respiratory tract. It's definitely something causing me to cough things up. Can't guarantee it's an infection, but it makes sense. It makes the most sense that it was a chip, but you never know. You can get bacterial infections that are contagious. They haven't tested for bacterial infection, which is interesting, isn't it? I'm saying pretty confident it's a bacterial infection. They haven't tested for it. I just assume I'm wrong. I mean, I have to say, doctors do quite reasonably do exclusionary tests, and it's quite reasonable to do it if what I'm complaining about is proven wrong. So let's say they did, and this is the thing, they don't always necessarily have to assume I'm not telling the truth, because sometimes patients get it wrong. But you'd think, at least in one of the earlier tests, they'd test. I mean, I could have done a neck x-ray for this part. Could have done that. They're right there doing the chest x-ray, do a neck x-ray with it. Could have put a tube down, could have done a test for bacteria. They didn't do any of them. So they've assumed I'm wrong about that. I'm pretty confident I'm right. Maybe I'm not completely right, maybe I'm wrong. But all they've done is test to exclude that. So test to exclude other things. They're saying, well, it's not a cold. It's not COVID-19. It's not influenza A. It's not influenza B. Oh, what is it? Oh, it must be a cold. No, it's not. Oh, it must be a rare virus that we haven't tested for. And we don't even know of a rare virus that matches this. I mean, maybe there is. I'm not aware of any. I asked the AI. I mean, useful as it is. I checked onto Google. There are a few that sort of match some of the symptoms. And look, I'm obviously I'm not a doctor. I'm not able to get into that sort of complication. But there didn't seem as if there was anything that matched it exactly. So it seems as if it's probably not a rare virus. Um, Now they suggest cancer for one thing. I heard them say that. I don't know enough about what sort of cancers to know if that's plausible. Um, Obviously I don't want to have throat cancer or any cancer. Cancer is a bad thing to have. Um, just sort of whispered that without me hearing and saying that surely it's not cancer. Well, I don't know. I don't think it is. But from what I'm aware of, it's not. I think it's more likely to be, you know, the thing stuck and just it being worse when I lie on my side. Um, I think that makes sense. But, it could be something scary like cancer. The thing is, if it was cancer and they tell me, oh, I'm sorry, it's cancer. Okay, what can you do about it? If they say, oh, it's inoperable, well, I can tie up my affairs. Like I don't want to die, but give me an amount of time to live, and I can just do whatever before that happens. You know, make sure I do my will, ignore things that don't even matter, and just sort things out. Because when you've got a amount of time, like I'd rather die of cancer, with at least a guess as to how long I have, and I know they don't like to give you times anymore. I'd rather die like that than just die in my sleep. Rather die being able to plan for it. That's how my grandfather died, or one of my grandfathers. The other one just died of an allergic reaction. I'd much rather die knowing I've got cancer that's going to last a certain amount of time, rather than just going in and see you tomorrow, and then we never see him again. So, but also I know most cancers are operable. I actually have a little polyp in my nose. It's about there somewhere. I won't be rude and point it out, but it's actually in there. That's a precancerous polyp in my nose. Don't really care about it. It's a bit annoying. It's actually really difficult to have it removed. But even if it was full-on cancer, that's not going to do much to me. I mean, I might end up with a little hole in my nose and have to get a skin graft. It's annoying, but not life-threatening. It's only life-threatening if it sort of goes to my brain. And maybe even that little polyp ended up down there. Maybe it sort of mutated and should have taken it a bit more seriously. But yeah, most cancers can be removed. Particularly if they're fairly early on. And if it is a cancer, I'm hoping that they would just be able to do a little surgery in there and just pull it out, cut it off, pull it out. Maybe even make me swallow it. I don't know if they do that. I mean, I'm just sort of guessing. If it's a tiny little ball or whatever, and they just sort of dump it down there and I swallow it and it comes out my backside. I don't know if that's what they do, but I just sort of imagine they might do that. I wonder how that'd taste, but anyway, yeah, and if obviously you have things like radiotherapy, chemotherapy, which are less likely to work, but you have to do them when surgery's not possible or where surgery fails. So surgery is usually the first option, and then you go to, I think chemotherapy and radiotherapy depend on the circumstances as to which one's better. You know, because radiotherapy, they sort of blast you with radio waves and they can cause damage to other things. That can be a bit dangerous, but chemotherapy, they give you stuff that makes you really sick. I actually think for me, probably chemotherapy probably wouldn't work. I don't know that radiotherapy would work either, but it's probably a better chance. So, yeah, you'd go for those things and then you'd see what happens. I'd definitely prefer surgery. I don't know, they might say, well, we should have got rid of that thing there. And you might say that girl that punched me in the throat, probably should have gone to jail for it. And, contributing to my early demise, my early death. Not that obviously being punched in the throat can cause cancer, but yeah, it's an interesting thing. And I mean, I'm not saying I do have cancer. I don't want to be one of these people that says I've got cancer when they don't. But you know, I mean, I've already got a chance of having cancer down my backside that they're not able to really notice. So it's not like it'd be a shock. Um, obviously don't never smoke. Um, but yeah, I mean, these things can happen, and yeah, it's. I mean, maybe they'll tell me, oh, you got cancer, but you got like 3 years to live. I don't know. I think when it's a stage when they can't operate, it's usually don't have that long to live. But I don't know. I mean, maybe they'll say to me, "Oh, it's a little cancer. We can just cut it out. We're pretty confident it'll work. We try that. Probably will work." Um, or maybe it's not cancer and it's just something stuck there. Um, which hopefully they can just pull out or cut out or whatever. Um, because I can't take general anaesthetic or it'll kill me. At the moment, I can't lie down, or that can cause these reactions. So I'd probably have to be sitting up while they do whatever they do, sitting up and awake. I can just imagine them strapping me up to try to stop me from moving. I can take other things. I can take conscious sedation and stuff. So yeah, it's going to be pretty risky. Whatever ends up happening there, might end up being quite expensive, and so forth. So yeah, look, it's a pretty scary situation to be in. And obviously they're telling me try not to stress about it because the stress can make it worse. And there's one theory is that my stressing about it, my worrying about it, is actually creating the blockages. And so I'm trying not to get too upset. Um, it's often difficult to not be too upset when you might die. And this is I'm not going to say this is the worst thing that's ever happened to me. There's obviously been a lot of bad things that have happened to me over the years and over my life. And, I don't even describe these as near-death experiences. I've had some doctors say that, and I say, no, when you have a near-death experience, you can see God, and you leave your body, and you have weird little coma dreams. Near-death experiences are lots of fun, or certainly the ones I've had. This was just empty. There was no God, there was no leaving body, there was no fun bits. It's just blank. And that's not what a near-death experience is to me. These are times where I nearly died, but nearly dying and having a near-death experience are not the same thing. So I don't rate these as near-death experiences. I'm not saying I've had 18 near-death experiences. I think that's not fair or accurate and not respectful to actual near-death experiences. I think that I've had 18 times where I had total airway blockages and I could have died if I wasn't able to resolve them. Although I suppose I can't guarantee I would have died. Just certainly felt that way. I mean, maybe if I didn't resolve the blockage, it would have just collapsed. I mean, if the blockage is caused by stress, maybe me passing out from lack of oxygen could de-stress it and then I start breathing again. It's quite possible. I don't know if that's the case. I mean, if it is, I'd be very happy. But I don't know if that's the case because I haven't, it hasn't been assessed. And most of the doctors have just given ridiculous claims that haven't really gone anywhere. And yeah, just talking, oh my God, just talking now, it all reverberates, which is kind of nice in some ways, but just talking seems to make it worse. Because obviously your throat includes your vocal cords, your ability to talk and make sounds. So maybe I shouldn't be talking. Maybe I should just shut up. Anyway, so look, that's probably about all really wanted to talk about with that. But and I've actually had worse, like with this whole situation. I've actually had worse than the total airway blockages, because 3 times I had how could I describe it? Thickening of the throat, where it seems to just completely switch off, and it goes from one side to the other. I've had it get to 2/3, 3/4 of the way through, which means I've only got this little patch where I can breathe. It sort of comes from right to left, or maybe it comes from left to right sometimes. I've had 3 of them. For all 3 of them, I went to the hospital, and for all 3 of them, the hospital ignored me. And they resolved spontaneously. Good. But those things can't be resolved with a cough. So they're actually worse. And I went to the hospital with all 3, and they didn't care about any of them. They resolved while I was in hospital. Good on them. Don't know why they resolved. Don't know why they started. Nobody's even guessed for them. So, I mean, while it's scary to have things where total airway blockage and I can only resolve it with a big cough, the closing down of my throat, the complete blockage of my throat gradually is worse. And they're not even believing that I've got a cough. So I've got a cough, total airway blockage, and the third one is thickening of the throat, which is even worse. They don't even believe that I have a throat infection. It's laughable and it's horrible. I'm just recording this just if I die, then at least people will know why, I suppose. It does feel like nobody's listening and nobody's caring. Which is not what you want when you're struggling for your life. If you did have cancer, at least people would say, oh, you got cancer, you'll care now. They might not, but they might. Not that I want to have cancer, but as I said, I'd rather them say I've got cancer than them pretending that there's nothing wrong. Because it's not nothing wrong, I'm sorry. And if this resolves by the time I see them, which I was a little bit nervous about, but after today, probably not going to be the case. I was worried that they'd say, well, whatever it was, it's resolved now, we can't do anything about it, bye-bye. Because this is the thing that doctors are always taught, to look for the simple solution. The simple solution is that it's resolved, that's what they go with. And that's a worry. It's a big worry for me. I mean, I'd obviously rather it's not cancer, I'd rather it's what I think it is, which is just something stuck in my throat they can just pull out. Or just give me some medicine and it sort of washes it out. And maybe I'm on the wrong medicine at the moment, whatever, and they say, oh, take this, deal with this, and it fixes it, and we're all good. But if it is something serious, I want to know. I don't want to be just dropping dead. I want to know, even if it's something that can't be treated. Because if they say it's cancer and it can't be treated, I'm like, you try. You try. I'm not giving up. And I'll try. I'll try. Maybe I'll go for alternative things and go to Chinese medicine and hippie medicine and all that sort of stuff, and all the different things that I can. I'm not just going to give up. I'm not just going to say, oh well, I'm going to die, bad luck. That's not how I do things, and I'm not saying that anyone that does that they shouldn't be doing it, but it's not how I do things. Yeah, that's all I wanted to say. Bye bye now.